Faster response times means more lives saved. In 2014, Bend voters approved a levy that allowed the fire department to improve its response times at a lower cost despite a growing number of calls.
4 years now into this, we're pleased to say that we've accomplished both that. We've lowered response times by over a minute in the city, and we've also improved our resuscitation rates.
Since 2012, our survival when we initially measured it was about 20%, and that actually was below the national average. Since putting on additional staffing since the last levy, we've seen our survival rates rise to 71% in 2016.
The Bend Fire Department responds to over 10,000 calls annually, and since 2013, we've seen an increase in call volume of approximately 25%. About 82% of those being medical emergencies, and of those 82%, 60% are advanced life support calls, and 40% are basic life support calls.
Numbers are great, but what do those numbers mean? Many more people are going home to their families, and that's the most important thing. Statistics are fine, but these are people, brothers, sisters, mothers, going back to their family to have more life.
Since we passed the levy in 2014, we're able to get the right amount of staffing and equipment available to respond to calls as they come in. This means we're prepared to get the right resource on location to save lives and protect property more frequently than we could in the past.
Since the levy passed in 2014, we've been able to employ 24 EMTs that staff 2 full-time basic life support ambulances.
What this levy means to the people of Bend is with that increased staffing level, we can get to your emergency quicker.
This levy is critical to the citizens of Bend to continue providing quality service from our first responders.
The people of Bend are lucky to have such depth in their staffing. This allows us to respond to all kinds of calls that come in.
By being there quicker, it's going to improve your chances of survival from all sorts of things: stroke, heart attack, traumatic injury, all of those.